Innovations that take healthcare beyond a hospital's four walls and empowers people to take charge of their own wellness are the promises of a better future. My guest today, Walmart Senior Vice President of Health and Wellness Transformation, Marcus Osborne, knows that the future of healthcare must be focused on wellness and supported by companies that assume new roles to drive value in the health ecosystem. Marcus, you spent the majority of your career outside the healthcare sector, and yet you've become a driving force in healthcare transformation. Can you share what values inspire you to want to change healthcare and do it from a slightly different vector at that?
Yeah, I mean, for me, it's pretty simple, and it involves a lot of, my previous career was in businesses and in industries that were very much about the consumer, financial services for consumers, retail, obviously. And so I think what motivates me is probably not a lot of people are motivated by positive things. I'm at times motivated by frustrations. And I think what motivates me more than anything is, of all the things that people in the US are frustrated about, the number one thing is healthcare. And, it doesn't matter if I'm talking to my mom or my dad or my stepmom or my brother or, my neighbors or friends or people I don't even know. It's like the story always ends up about some frustration they've had with the system. And so I think for me, it's about this thing that, it feels with all the resources and all that we put into it and all of our ability to be creative and innovative as a country, as a society, that we should be able to do something to address this point of angst. It feels like that, and so I think that is the motivator. And we know, I've shared this a lot. When you ask the question, what is it that's really sort of causing all this angst? It's the lack, it's high cost. It's the sense that I can't afford the care that I need for myself and my family. It's this sense that healthcare is not accessible or convenient. I can't get what I want when I want it and the way I want it. That it's intentionally complex. That it's intentionally unsupporting. It's intentionally not serving. And so I think what motivates me is I actually think we have an opportunity to make it affordable, to make it convenient and accessible, to make it simple, to make it people feel supported and cared for, and fundamentally improve the health of Americans and lower costs at the same time for the whole system. And I think so that's it. I mean, it's, I didn't ever want to be a doctor. That wasn't what kind of brought me to it. But I'd love for healthcare not to be, and the challenges that people are facing with healthcare be the prime topic of half the conversations I have.
Yeah, well, I think you're really interesting that you talk about coming from that consumer approach, and as providers, we're seeing a gradual shift in the way we think about patients more as consumers of healthcare. So I'm wondering if you could explain a little bit more. Why do you think this is a good thing, and how does consumerism guide your health strategy at Walmart specifically?
Yeah, I mean, as I sort of think about when I think about consumerism, and consumerism is thrown around quite a bit, I'll try to quickly define what I think that means and what the change is. And this may feel a little academic, but I don't. Hopefully, it doesn't. Hopefully, it isn't. But I think the tendency today is that I see from the system is to create solutions that's sort of based around what I've often called the balanced interest paradigm, which says if you want to create a solution that works in healthcare, you have to, if you can address the needs of the consumer, the patient, of the provider, of the health system, of the payer, of the health plan, of the product manufacturer like pharma and device manufacturers, if you create a solution that addresses all their needs, then you will create a solution that wins. And what I'll tell you is that actually is wrong. I mean, what I've seen is that more times than not, those solutions don't win, they don't work. But what I have seen is the groups who create solutions who say, the only person, the only entity who matters is the patient, is the consumer, and that the rest of us are there to serve. So I believe that at its core is really meant when I say consumerism, what I mean, which is creating solutions that fundamentally says the only person in the center is the consumer, and we're all there to serve. The reason why it matters is, and what I've seen over and over, is when you create truly consumer-centered approaches, those approaches drive greater consumer engagement. When you drive greater consumer engagement, it gives them greater empowerment and control over their health. When they get greater empowerment and control over their health starts to improve. When their health starts to improve, costs go down. In other words, it's a win for everybody. Health improves, the costs go down. Actually, what we find is providers' lives get a lot easier. The stress on physicians and other health professionals declines.
So Marcus, we're going to now enter the rapid fire phase of the conversation, and appreciate your best top of mind thoughts to these questions. So first is, if you could wave a magic wand, what's the one thing you would change about healthcare tomorrow?
Yeah, I work for Walmart, save money, live better. It would be, and this probably won't surprise anybody, significantly lower the cost of care for people. Make it so that it's so affordable that everybody can get the care that they need right now.
Yeah. And if you, next question, if you could meet, so you meet all these startups and other partners all the time, tell us, what is the biggest red flag when someone's approaching you with an idea or a solution?
Well, I think it's that they're too often pitching me a solution or their product without any respect or understanding of the fundamental challenges or problems that I'm trying to solve for. And so if you're pitching me a product, you're probably not going to go very far. If you're coming in wanting to have a conversation about the challenges I'm dealing with, and we spend 90% of the time, I think that Einstein quote, whatever, spend 90 or 95% of your time on the problem and spend 5 to 10% on the solution. I think those are the ones that are successful.
Yeah, that's critical. All right, last question. So, you've had such a great career thus far in terms of healthcare transformation. What's your best piece of advice you've either gotten or want to give to those who want to follow in your footsteps and really make a difference in changing our system of care delivery?
Well, it's funny. I didn't know this person. He's a poet, Langston Hughes. I think a number of people kind of heard this, but it is. I don't know why it's this short poem that bounces around in my brain all the time, but it guides me every day. And it's called Motto, and it goes something like this. I play it cool and dig all jive. That's the reason I stay alive. My motto as I live and learn is dig and be dug in return. And so that's the poem. And so it is. I actually think if people in healthcare listen to it, it talks about the golden rule. It talks about being open to innovation. It talks about listening. I think all those things are critical to success in healthcare.
Marcus, that's awesome. Thank you so much for your insights, and thank you so much for what you do every day.
Thank you, and thanks for having me. This is great.